Welcome to our webinar on how to introduce Fesia Grasp in your daily clinical practice. We will commence in a couple of minutes. Thank you for waiting. Welcome to our webinar on how to introduce Fesia Grasp in your daily clinical practice. First of all, we would like to provide a bit of context. Fesia Technology is a Spanish company with more than 10 years of research behind. Our main goal is to provide functional electrical stimulation solutions that enhance the usability, adherence, and final results of the rehabilitation of the neurological patient. We are very glad to say that most of you already are using Fesia Grasp on your daily basis. This webinar is meant to provide you with tools to enhance the clinical use of Fesia Grasp. The structure of the presentation will include research publications, guides of use, a practical case, tips and recommendations, all followed by a Q&A round. This webinar has an open chat where you can write down all your questions. We will answer them during the Q&A section, and in case we run out of time, we will make sure the answers are delivered by email. Without further delay, we would like to introduce you to today's main speaker, Aitor Martin, physical therapist with a master's degree in neurosciences and clinical applications manager at Fesia Technology.
Good morning and welcome to our webinar, How to Introduce Fesia Grasp in Your Daily Clinical Practice.
Welcome to our webinar on how to introduce Fesia Grasp.
Speak about how to introduce Fesia Grasp in daily clinical practice, and this is today's agenda. First of all, I will be speaking about why FES for upper limb rehabilitation. Secondly, I will speak about the main topic of today's webinar, which is how to introduce Fesia Grasp in daily clinical practice. And thirdly, we will see a clinical case of a patient of Fesia Clinic, our own neurorehabilitation center here in San Sebastian in Spain, and we will show practically all the theoretical contents about I have been speaking about. Starting with the first part, which is why FES for upper limb rehabilitation. I will differentiate this answer in three different parts, which are the most important ones. There are other reasons also, but these three are the most important ones. The first one is because the scientific evidence that supports the use of FES for upper limb neurorehabilitation is solid and robust. The second is that there's a high incidence of neurological diseases affecting hand dexterity. And the third one is because FES is an easy to integrate technique in the daily clinical practice. Starting with the first of the reason, the scientific evidence, which must be taken into account in all treatments, but also in neurorehabilitation. There are more than 40 published randomized and controlled clinical trials about FES. Randomized and controlled clinical trials are mostly high quality papers, and there are lots of types of studies, but summing up all this information, there have been seen improvements in three different type of parameters. The first one are biomechanical parameters, for example, active or passive range of motion, or spasticity measured with the modified Ashworth scale. There are also more functional parameters like Fulk-Meyer upper limb test, also ARAT or AMAT tests, but also neurophysiological parameters like motor evoked potential, electromyographical assessments, and so on, that ensure that there is a neuronal repair mechanism, there is neuroplasticity, which is one of the main goals of neurorehabilitation. What does this mean? That the most important clinical guidelines of rehabilitation in the world, like these two Canadian best practices guidelines, recommend the use of FES for upper limb rehabilitation with an evidence level 1A, which, as you know, is the most important or the higher evidence level in the world. The second point is the high incidence. As you know, the number of cases of neurological diseases is increasing each year. And for example, in 65% of stroke patients, their hand is affected and they cannot do their activities of daily living correctly 6 months after a stroke. And this means that we need effective rehabilitation techniques to improve the quality of life of these patients, because the loss of functionality of the upper limb affects the quality of life in very importantly, producing in many cases that people become dependent, producing issues in social areas, psychological areas, and economic areas. And why is the hand so affected? The answer is clear. As you can see in this well-known image of the screen, which is the Penfield's homuncle, the representation of the hand and the wrist in the motor cortex, in the Brodmann's fourth area, which is the right side of the image, the hand has a high representation. This is good because in a non-pathological situation, the hand dexterity is really high and we can reduce very difficult movements and in a very precise mode. But when there's a issue, a disease in the CNS, in the brain in this case, the hand is very, very affected. And the most affected parts are the fingers and the wrist, and most concretely, the extension of these two parts of the upper extremity. And the third part is because it is easy to integrate technology. But how can we integrate it? Today we will speak longly about this, but there is a wide range of exercises that can be done with the FES technology. It's a easy combinable technology, and many type of patients can use this FES, which is important because all type of neurorehabilitation centers are going to be able to use this technology. And what's our solution? Fesia Technologies' solution is Fesia Grasp. Most of you already know this device, which most important goals were related with improving the characteristics that I have been explained before, as the wide range of patients with different protocols. We can achieve the treatment of different types of patients, also improve or allow the simultaneous attention to patients, because it is not needed a therapist all the time with the patient. Also to give a technological and innovative image of the clinic, of the hospital, and so on, because of the technology it brings. Also an enlargement of services, but without need of high technology knowledge for the therapist. And lastly, it is an accessible device for all type of clinics, for big hospitals or big rehabilitation centers, but also for a little clinic which is in a little town in any country. And what's the most important part of the device, and the part which brings most of these advantages? It is the multi-path electrode. This well-known technology for most of you is an electrode which doesn't comprise one cathode and one anode as the classic one-to-one electrodes as, that you can see in the right part of the screen. Our Fesia Grasp system's electrode has 32 cathodes and 8 anodes. And what does this allow us? This allows us, the clinicians, to stimulate 8 different selective movements, which are these 8 movements: the wrist flexion and extension, thumb flexion and extension, index flexion and extension, and fingers flexion and extension, by stimulating 14 different muscles. We can be very, very, very selective. We can stimulate very little muscles like thumb flexors and extensors, for example. And this is important because it will allow us to adequate the stimulation pattern to the needs of each patient. And what can we do with Fesia Grasp? Things like the following clinical case. This is a patient of our rehabilitation center who suffered an ischemic stroke. And first of all, we started training more selective movements. And then once these selective movements were improved, we passed to train more functional ones. At the beginning, they were difficult to produce. We also combined FES with other therapies, like, for example, mirror therapy here. I will explain after how we can do this combination. Then we did more selective grasps and also trained more functional actions. And nowadays we are planning new goals and trying to achieve them using Fesia Grasp, among other techniques. Okay, thank you. Now we will go to the next part, the most important one, which is how to introduce Fesia Grasp in daily clinical practice. First of all, I will explain a thing which is important, and is that there are no standard rehabilitation protocols, because as in every disease, also in neurological disease, all patients are different, and it doesn't make sense to create standard protocols because they are not going to be adapted to the needs or the goals of each patient and family. Therefore, it is essential to create a personalized rehabilitation program adapted to the needs and the goals of the patients and patient's environment. And therefore, there are some tips which we will explain now. The tips are these 3. The first one is to select correctly the patients and the protocols. The second one is to correctly calculate the treatment dose. And the third one is to select the correct exercises to improve the deficiencies of each patient. Starting with the selection of the patient, the first and the most important question always is the one involving contraindications. If there are contraindications, the device must not be used. If there are not, we can pass to the next question, which is, does the patient meet the inclusion criteria? Are there, is the patient one of the patients who has a neurological disease in which FES has been used? Has the patient hand dexterity deficiency or impairment? If he or she doesn't have this problem, we don't have to use the device. If yes, we can pass to the next objective, which is, can it help to achieve the objective or the goals of the patient. If not, it doesn't make sense to use the device. If yes, we can plan now a treatment protocol with the Fesia Grasp. And now we have to select how to use it. If the spasticity or sensation is too high, we have a specific protocol, which is called training protocol, which can be used in this types of patients, both for decreasing spasticity or decreasing sensation and achieving a motor threshold without achieving the pain threshold. If the spasticity or sensation are not too high, we can pass directly to use the GRASP protocol, which is the most functional one. And we can differentiate two different phases. The first one is the one involving more selective contractions, as I have explained before in the video. And we can train these selective contractions both in isolation or also in combination. The most known combination is the one with mirror therapy. And it's an easy combination. And the second phase is the one in which more functional movements are trained. And they can be trained combining different contractions of different joints. For example, the contractions of thumb and other fingers extensions, but also activating only the movements which are needed for each functional action. The second point is the ideal treatment dose. This is a very common asked question, and there is no single answer, but there are also some tips which can help us, the clinician, to correctly select the treatment dose. And the most important tip is to increase this dose progressively and to monitor correctly the reactions of the patient. It doesn't make sense to start using Fesia Grasp 2 hours a day from the beginning. It must be used little by little, increasing the intensity day to day, and paying a lot of attention to the muscular fatigue, as I will explain in the next slide. These are the 4 critical factors. The first one, of course, are the goals of the patient and or the family or the environment of the patient, because depending on the goals and the help Fesia Grasp can provide to achieve these goals, it must be used more or less. The second one is the patient's condition. There are some diseases in which muscular fatigue appear earlier, for example. The third one is the available therapy time, which must be a very important factor to take into account, because it is not the same to have a patient 10 hours a week or 1 hour a week, and the amount of time that we are going to use the device is going to be bigger in one situation than in the other. And the fourth one, and probably one of the most important ones, is the muscular fatigue. If we start using the device for a lot of time from the beginning, the muscular fatigue is going to appear too fast, and then after the session, the patient is not going to be able to voluntarily contract the muscles to perform the functional actions that must be done in the activities of the daily living. Therefore, it is important to achieve this muscular fatigue in the therapy sessions, and that's for we recommend this diagram, which differentiates 2 different situations, which are like the most extreme ones. The first one is when patient receives less than 5 hours a week of physical or occupational therapies, and the other one when they receive more than 5 hours of physical or occupational therapy a week. In the first situation, We can use the Fesia Grasp for around 40 or 60% of the time, because it will bring us a lot of advantages, and the muscular fatigue is not going to appear too fast, because the total amount of time is not going to be so high. But in the other situation, in which a patient is going to be treated for more than 5 hours a week, we don't recommend to use Fesia Grasp for more than 50 or 30% of the time, because there are also other very effective techniques that will allow a rehabilitation in the patient involving other joints or other parameters. And the third, and I think the most important part, are the exercises. What can we do with Fesia Grasp? We know it is a very selective device which allows us to produce very selective movements of most of the joints of the hand. But how can we use it in a real treatment session? The first exercise is the most easy one, which are repetitive movements. These repetitive movements can involve different muscles, for example, only agonist or extensor muscles, but also combine the agonist and antagonist muscles. Select one or more joints, for example, select only the index extension, or also combine it with all the extensions of the hand joints. And finally, we can ask the patient for a voluntary contraction while the device is stimulating the muscle, or we can only stimulate without voluntary contraction. The second exercise is a little bit more functional, and are the combinations of contractions to achieve different type of graspings. Here we have two of the ones which are pre-configured in the Fesia Pro application, which are the pinch, which involves the index and thumb extensions and flexions, and the lateral grasp, which is the combination of the thumb and fingers 3, 4, and 5 flexion and extension. We will see these exercises after in the clinical case. The third exercise is similar to the one before, but involves all the fingers, which is the palmar grasp, which consists on extending all the fingers and then flexing them again, and can be combined with or without displacement in a desk, for example, or done with different objects, heavier or bigger objects, or lighter or smaller objects. The fourth exercise is even more functional. Here we are training the pickup of food with a fork. This is a really usual situation, which is the patient can contract correctly most of the fingers, but not the index while picking up the food with a fork. And what we can do is to manually contract this, select the contraction of the index flexion in the moment we want, when the patient is picking up the food. And this is interesting because this allows the patient only to stimulate the needed movement, in this case, the index flexion. And we can do it from the configuration screen of the Fesia Pro application by pressing the test button in the moment we are interested in. And the fifth and last exercise is a classic exercise to drink from a glass. And there are different options to train this with Fesia Grasp. We can do it with the palmar grasp, involving all extensions and flexions of the fingers, but also only stimulating the needed movements, the movements which are impaired in the patient. It is classic to have the need of configuring the thumb extension in the moment of grasping the glass, and can be activated manually as explained before in the previous exercise. And lastly, before going to the clinical case, just mention that there are lots of neurorehabilitative techniques that can be combined easily with FES. Here in the screen, you can see some of them: the task-oriented therapy, the botulinum toxin, the action observation plus brain-computer interfaces, bilateral art training, mirror therapy, but there are others like robotics, virtual reality, strength training, and so on. And here I am going to explain two of them. The first one is the mirror therapy. There are 3 published randomized and controlled clinical trials studying the effectiveness of this combination. And these studies have shown that combining FES plus mirror therapy improves the rehabilitation outcomes even more than using mirror therapy or FES in isolation. Here you can see a video of a patient of Fesia Clinic using the Fesia Grasp with the palmar grasp function selected, which combines all the extensions. And I asked the patient to produce the same movement in the less affected arm and hand in the same moment that the stimulation arrived to the arm, so that the input that arrives to the CNS is doubled. First of all, the stimulation is being produced in the arm, but at the same time, the occipital part of the brain is seeing and is receiving this input that the movement is being seen in the apparetic arm. And another combination, an easy combination, is the one with botulinum toxin, which has been widely studied. And there are 2 different options. The first one is only to stimulate the extensors, but we can also stimulate extensors and flexors. The toxin is usually only injected in the flexor muscles because are usually the most spastic ones, but the stimulation can be produced in both the flexor and the extensor muscles, because it has been shown that even if before we thought it was different, by stimulating the flexors, the spasticity doesn't increase, and it does decrease. It is a neurophysiological mechanism that allows us to decrease even more the spasticity by stimulating these muscles. And finally, we are going to see all these theoretical contents here in a clinical case. First of all, I have to say that the clinical case is not real. We have an actor to bring our arm to show you how we can work because of a confidentiality term. And we will present the following hypothetical case, which is a 25-year-old woman with a traumatic brain injury, which occurred 5 months ago. And she is coming to rehabilitation 2 hours a day for 5 times a week. She suffers a monoplegia and monoanesthesia in her left upper limb, with a partial paralysis of the wrist and finger extensors, and her punctuation is in the modified Ashworth scale is from 1 out of 5 in wrist flexors and extensors. And there's another important thing, that is that she likes to train with mirror therapy, and we have to take this into account. Now we are going to see 2 different things in the screen. The first one is the arm of the patient, and you can also see the Fesia Pro application. Okay, here I am going to be controlling the application. First of all, here in Fesia Clinic, we usually start contracting more selective movements, and we will, Rachel, now start working with the wrist flexion and extension. It is not necessary you to control to try to improve more the movement. Okay, now only Fesia Grasp is going to produce this movement. As Rachel is a common patient in Fesia Clinic, all the movements are already configured, and it is not necessary to configure them each day. And the session can be started very, very fast. Okay, now we are going to start doing the same movement, okay? But I want you to help a little bit, both the flexion and the extension, okay? Let's start now. And as you can see in the Fesia Pro application, I am going to decrease the intensity from both movements so that the voluntary contraction is higher and the component of contraction done by the stimulator is going to be not so important. Perfect. Now she's below the motor threshold. I know her motor threshold, and I know now most of the movement is being produced voluntary. Perfect. Now we will repeat the same, okay, Rachel, but with the next movement, which is going to be the thumb flexion and thumb extension, okay? Let's select these two movements. Here I have the repetitions configured continuously, but it is also possible to establish a number of repetitions, but I am going to be working until I press stop. So I press it continuously and I press start. Now I will increase the intensity. And you can see that the movement is extremely selective. Previously, it was said that it was not functional to treat selective movements, but last studies have shown that it is very, very useful to combine both selective and functional movements. And we do the same now as in the previous exercise. I will start decreasing the intensity, and I want you, Rachel, to try to help a little bit the movement. Okay. Perfect. I try to touch her tendons so that I ensure that there is not being any contraction in the other fingers. Perfect. Let's stop now. The next exercise, Rachel, is going to be the same, but as I have been explaining before, we are going to combine it with the mirror therapy. Therefore, we are going to introduce Rachel's paretic arm in a mirror, and I will ask her to put her other hand in front of the mirror and to see the mirror, so that she is watching a left arm moving, but she's going to be moving the right hand. And what I am going to do at the same time, I am going to select the same previous movements, which were the thumb flexion and extension, and I am going to ask her to produce the same movement with the non-paretic hand at the same moment. Okay, let's start now. I will increase the intensity. And now the input arriving to the CNS is double. The first one, she's seeing her paralytic arm producing the movement, but at the same time, she's producing the same movement in the paralytic arm, and this is very interesting. Perfect. Here we are training the thumb extension, but we can do the same for the index flexion and extension, for example. Let's try these two movements. That's it. Only the index. Perfect. And this is a very interesting movement before training the pinch. Perfect. Let's retire this mirror now. And we are going to pass to a more functional exercise. That for the first one, we are going to select the pinch, which involves, as you know, the extension of index and thumb and the flexion of both fingers. The movement is the following. It extends both fingers, flexes them, and extends them again. Okay. First of all, I will ask Rachel don't to produce any movement, only to know which are the times. 2 cycles, for example. Now it stops and it will repeat the cycle. That's it. Extension, flexion, perfect, and extension again. Now, perfect. And once she's used to this configuration patterns and she knows more or less which are the times, I am going to ask her to pinch this object here and to introduce it here. And then in the next pattern, the same, but in the other direction. Okay, Rachel, I will start it now. Perfect. Introduce it and extension. And in the next cycle, do the same, but in the other direction. Perfect. Let's do the same. Perfect. Well. Perfect. Let's stop it now. And we are going to train another functional movements preset in the Fesia Pro application, which is the palmar grasp. Okay. It is important that you to know that it is going to be extending all your fingers. It will flex your fingers then and extend them again. First of all, we will do it without object. I will select the palmar grasp here. And first of all, as before, just select all the movements you to know which are the times. Perfect. And once we know the timing, we can grasp this object and left again. Perfect. We can grasp it again and you can put it here, for example. It is difficult. Okay, perfect. Very well. Grasp it again. Very well. Okay. I have stopped the movement now, and the next exercise is is going to involve also the pinch, but I want you to increase by your own the flexion contraction. Therefore, I will select the pinch here, and as you already know the times, we are going to repeat the previous exercise, but once you have pinched this object here, I am going to retire it, and you don't have to let me. Okay? Let's start. And this is an easy way. Okay, I am trying to retire it. As I was saying, this is an easy way to train the voluntary contraction of functional graspings. Perfect. And just to finish, we will train another difficult or more functional movement, which is the classical one, which involves the grasping of a glass. Therefore, we will imagine that Rachel doesn't have any problem to extend the fingers 2, 3, 4, and 5. And we are going to select only the extension of the thumb, which is the more impaired movement in this patient. Therefore, I came to the previous screen, the configuration screen, and I select the thumb extension, which is already presetted, is this cathode at 14 milliamperes. And what I'm going to do is to ask Rachel to grasp the glass, and in the moment that she is being here, I am going to help her by extending her thumb to grasp it better, okay? And the same thing while releasing the glass. Let's try it now. Try to grasp the glass, and I'm going to press the thumb extension. Perfect. Grasp it and release it now. And I am going to press test to help her thumb. In this way, we can be very selective and train the impaired selective movements of the patient. We will do the same now, Rachel, but once you have grasped the glass, you are going to try to drink from it. Okay, let's try to grasp it. I press test to extend the thumb. Once it is grasped, try to drink. And now we release it. I press test. Perfect. And this is an easy way to use Fesia Grasp in a very functional way by only stimulating the desired movements. Okay, I think we have already seen different exercises, and now it is time to finish my presentation with some conclusions and take-home messages. I have selected these four ones, which I think they sum up a little bit all the content. The first one is that FES, for upper extremity rehabilitation, has strong scientific and technological support. The second one is that Fesia Grasp has certain features that increase the usability and clinical possibilities of FES therapy in neurorehabilitation. The third one is that there are no established protocols for the use of Fesia Grasp, but there are some questions that the clinician should consider when planning a treatment. And the fourth one is that Fesia Grasp allows you to perform a wide range of exercises of different difficulties, as well as to combine it with other techniques in a simple and effective way. Finally, I would like to thank you all, your attention. It has been a pleasure for me to be in front of you, the community, using Fesia Grasp in all around the world. And now, as explained before, we have a Q&A round. I think there are some questions. Okay, perfect. The first one is, can Fesia Grasp be used in a patient with no contraction possibility? A 0 score in Daniel's scale. The answer is yes, and it is very interesting because FES allows us to work and to train all type of patients, also patients that don't have any muscular contraction. And it is interesting, for example, in chronic patients in which spasticity is really high and they don't have any contraction. When using the device, spasticity decreases in a very fast way, and it allows us to work even better after with more functional activities. The second one is there any contraindication with very high spastic patient Ashworth 5, for example? It is no a contraindication. It is a recommendation don't to use in so spastic hands. No, because it produces a bad effect, but yes, because the effects are not going to be so good as in other patients. It is interesting to use Fesia Grasp in this patient for the decrease of the spasticity and to train other more functional or other exercises after once the spasticity has decreased. Okay, the next question is Fesia Grasp recommended in peripheral nervous system rehab therapies? The answer is also yes. As you know, most of the bibliographic documents speak about CNS problems, but there are also some studies which speak about the use of FES for this type of peripheric patients, for example, obstetric paralysis, brachial paralysis, or nerve sections. It is true that some electroparameters must be changed if the clinician who is asking this question wants to know more about this. I invite you to write us an email, and it will be a pleasure for us to explain you how to improve this contraction of peripheric nerves. The next question, is this suitable for every hand size? Yes, it is suitable. And we have a garment, a textile, which has a Velcro, which allows us to adapt to most of antebrachial sizes. If there is any problem with very big arms, you can close the garment in another way. You can also write us if you have questions about this term, but yes, it is thought to be used in every size of arm. The next question is, it is suitable for children? Okay, in regulatory terms, we don't have problems to use it in children. The limiting factor is the size of the electrode. If the electrode suits the size of the antebrachial area, then the device can be used. Of course, sometimes there is a little overlap in the electrode, and this is no problem if it is not too exaggerated. because we can, from the Fesia Pro application, block the overlapped cathodes and don't select them, to only select the ones which are in contact with the screen. The next question says, can I modify the duty cycle of stimulation individually in terms of remaining or maintaining the grasp longer if required? Now it is no available this, but we keep working and we keep improving our products, and I also recommend you to stay in touch with our commercial department, which will inform you about all these improvements, which will always be included in the software uploads of the Fesia Pro application. There's also a question regarding fatigue. Is it possible to create an alternating simulation of different arrays for the same movement to reduce fatigue? It is not possible to set this different cathode change, but you can do it manually, we will say. Therefore, I recommend you also to write us an email. It's a way to do it, and is by selecting two different movements in the configuration screen and select different cathodes which produce a same movement, and then select these two movements to try them in an alternating way to reduce fatigue. And it can be done, but not in automatic way. Therefore, there are lots of experts. Some of you probably know them. Ines Verge, for example, is a right person to speak out these things, and she knows a lot about how to decrease fatigue in FES treatments. And I think there are no more questions. So finally, I would like to thank you all again, your attention. It has been a pleasure for me to be speaking in front of you, and I again insist in that if you have any question, any suggestion about our devices, more commercial things, pay attention to our social media and also to our website, and also here in the screen you have our contact to write us whenever you want, with all time of these kind of things. So thank you very much. Sorry. There's another question, sorry. Last time question. It says, do you give the device for patients to use on their own? This is a really asked question. We do it, but it is important to know that it is a clinical device, and it is very important to be a clinician supporting this home use treatment. The treatment can be set by the physical or occupational therapist, and then once the configuration has been done by the scientific or clinician professional, then the patient can continue the treatment at home with the device, but always with the support of the clinician. And I think that now all questions are finished and answered. So I will thank you all again for all your attention, and see you in the next webinar.
We would like to thank you all for your time and dedication. We hope the information and guidance provided today encourage you to take the most advantage possible from Fesia Grasp and to start using it in case you don't have it yet.